Hello, I'm Virginia Van Epps. I'm the clinical manager for speech at Connecticut Children's Medical Center, and I'm very pleased to introduce this video story about us going live with the International Dysphagia Diet. We were also fortunate enough to be able to do 2 webinars with the IDDSI to explain in depth the speech pathologist perspective from implementing the diet. But this video story is really important because it helps to cohesively bring together all of the important organizational work that was done interdepartmentally, from the kitchen staff to our clinical nutrition area, nursing, and also the patient family perspective. We have had the opportunity to do quality work and present at conferences about this implementation, not only statewide but nationally, and of course the international webinars as well. And in addition to that, we have ongoing quality projects to continually make this a better process for the patients and the families and the staff. So without further delay, I would like to launch into these video clips that will give these perspectives from the various players. And I want to thank the IDDSI again for this opportunity. So we have Marni Simon and Jody Sigelko with us, who are both speech-language pathologists here on staff at Connecticut Children's Medical Center. And Marni Simon is also a board-recognized specialist in swallowing and took a lead role in bringing the IDDSI into the organization. And today they're going to talk a little bit about some of the challenges to implementing with the department staff and staff throughout the hospital, patients and families, not only the implementation, but then the education as well.
Yeah, well, I know Kamie got the opportunity to talk about a lot of this stuff before. I think one of the biggest things that we originally started to get some pushback was of what is the syringe test, because when we were starting to recommend different liquid consistencies and rolled them out on the floors, we did that a little earlier because it was more needed for our infant population for one, and then in some ways usually we were recommending more thickening of liquids with patients more frequently than the altered diets on the floors.
Right.
When we went to roll them out, I think the biggest challenges we had were pushback for, what are you talking about? I need to do syringes. Can I use just any syringe, and why does it have to be this specific way? What I did notice though is once you taught somebody how to do it, especially the nursing staff, and they got it, they were like, this is no problem. We can do this very easily.
I think one of the first things was, it's going to be too time consuming. I can't take time away from my other patients to perform the syringe test, but once we showed them, it was only 10 seconds. It was easier to implement.
Yeah, and then also carrying it over with the caregivers, and once the caregivers were taught, and then some of the patient care assistants were taught, and everybody caring for that patient was kind of on the same page, it went very easily for most of the patients we've seen so far. I think one of the biggest challenges that we face, and sometimes still face, is being in a pediatric hospital. We don't necessarily carry regularly thickened liquids to certain consistencies that might be found in other treatment type facilities or other inpatient hospitals. So mixing on the floors is always a challenge. We've tried multiple different ways, and I think we're still in the solution process for this. We've tried, we were trying to do individual blenders, but then there's infection control issues, sanitary issues. So then we're trying with our specific brand of thickener, shakers, and sometimes you still end up with clumps. So we're trying to find a happy medium.
Fork and whisking, things like that.
But in the end, it helps us. It also helps us to tell nurses why they need to use the individual syringe test each time.
Because it doesn't always come out consistent, depending on how you make it.
I will say on the outpatient front, the patient and caregiver education of using the syringe test and the diet testing has been wonderfully helpful. A lot of parents feel like they can bring it back to their schools or other caregivers in the child's life and be able to everybody be on the same page more easily. Before that, we were trying to do some line spread tests, which were messy and used a lot of liquid, and oftentimes you couldn't, parents and caregivers would come back and be like, we're not doing this each time.
It's too much formula each time. It was
yeah, I know.
almost 4 ounces of formula that you're technically wasting to test something, so parents didn't love that.
Yeah, and they find this very easy and able to do very quickly. Yeah.
I figure usually when I tell parents about the test, they get a little overwhelmed, but once you show it to them, explain it to them, they're easier. Like, it's easier for them to understand and implement at home. I have one patient and their family, and when I first told them we're going to try the syringe test, they're like, we have to do what? Like, they're very overwhelmed. But with the instructions and how simple it is, every time they come in, they say, oh, it's so easy to do that test, and thank you for showing me, because now I know she's safe when she's small, like when she's having her formula.
That sounds like a great success. Thank you.
Thank you.
Thank you.
Today we have Resa Squire with us, who is a nurse on our med-surg unit here at Connecticut Children's, and she's going to talk a little bit about her experience and thoughts with the IDDSI.
I thought that it was very easy to learn about and to use. It was my first time experiencing it, and I was given just a quick tutorial by our speech pathologist, and it was very easy to follow directions, and actually doing the process of testing the formula to make sure it was the right consistency was very quick and simple, and I thought that that was great. It was easy for me to learn, which in turn is easy for me to teach families, so that when they're going home they can safely feed their child the right consistency for their foods.
Thank you. So you think there are going to be challenges for implementing this fully on the floors?
I think just initially there'll be a little bit of challenges of just having people knowing the new process and the change in a little bit of the terminology, and now the actual process of how we're testing them and making sure we have the right consistency. But I don't think it's going to be something that's going to be difficult to implement at all.
That's great. And I know you work in nursing education
Yes.
specifically, and we put together the Cornerstone module for education. I don't know if you had the chance to view it yet.
I did, yes.
Okay. So do you think we're going to need to do something different or something to add to that, or do you think we're in pretty good shape with that?
No, as the nurse educator on the floor, I did it actually yesterday,
Okay.
just so I could see what it was about.
Mhm.
And it had a lot of information in there that was easy, I think, for everyone, from the nursing staff to the PCA staff as well, because they do a lot of the feeding of our kids here. It was easy to follow, and now knowing the process myself, I'll be able to just follow up with staff and make sure that they're actually understanding it. And I think it should go well.
Great. Thanks so much for your time and your input.
You're welcome.
All right, so tell me a little bit about your experience with thickening. So we started thickening for Max in February, and like anything with a baby, there was a little bit of an adjustment period. We took a little time to really understand what worked best for Max, because he didn't take just straight formula or just straight breast milk that we had to thicken. We had to do a mixture of the two. So once we figured that out and just put a little bit of time into figuring out the right ounces and temperature, it's made a huge difference for Max. It's reduced, he doesn't choke anymore when he's eating, which was a huge concern for us, as well as leaving him with our babysitter. And it's reduced the amount of times that he's gotten sick. He's only been sick once in a few months, as opposed to he was sick a lot more frequently before the thickening, because they found that he had the aspiration with the unthickened formula. So I can say that it takes a little time to get used to, but it's well worth it. The benefits definitely outweigh that brief period of time where you have to, spend making that adjustment and figuring out what works for you.
Kamie, can you tell me a little bit about the process of testing the formulas and the solids to get us going for the IDDSI, and not only about the detail of that work, but also about any of the challenges that you faced?
Sure. So one thing we did first was take all of the formulas that we use in the hospital, as well as the most commonly used liquids, and we actually we thickened them to half strength nectar thick, and honey thick liquids, and we tested them all multiple times using the syringe test to help kind of formulate some recipes that we could use as guidelines as we are thickening for our patients. That process took a good amount of time. We actually used multiple different types of water just to make sure that we can come up with a recipe that was somewhat consistent. And the challenges there were that we faced were different temperatures of the liquids, the different water, and the different nutrient makeups of the different formulas. So sometimes we had some inconsistencies. But the syringe test actually made that go much faster. It was a much more consistent and reliable test that gave us really consistent measures to go with. Testing the solids was a little bit difficult as well. So what we did was got a bunch of food from the kitchen that supplies food to our patients in the hospital, and we tested it using the different testing methods that the IDDSI outlined. Things like the fork pressure test and the spoon tilt test, those were all very handy, and we came up with a lot of data that helped us figure out what different foods would fit into the different food categories of the IDDSI. Some challenges that we faced were organizing with other departments, but that was actually very helpful in the end to hear everyone's different perspective, and also making sure that we could consistently test using the same fork each time, or testing food when it was hot and then also when it was cold to make sure that it came out consistently.
Did you have any challenges with the syringes specifically?
We did have a few challenges with the syringes. So originally we started using the syringe test right when the IDDSI rolled out. So we ordered the syringe that was specified, but we didn't realize that the barrel length had to be a specific size at that point. So we ordered some syringes, and then when the IDDSI specified that the barrel length had to be that specific length, we realized a little bit after the fact and had to reorder and then retest all of our formulas that we had previously tested.
Was it difficult to get those materials stocked throughout the hospital?
It was a little bit difficult. It was difficult to find the specific 10 ml slip tip syringe that we needed with that specific barrel length. And that being said, then it was kind of a long process to get it stocked in all the floors and make sure the supply chain had the correct one and that everyone was using the correct one.
So it sounds like despite all those challenges, you persevered and then really overcame.
We did. As a team, I think we did a really good job, and there's definitely still a lot of work to do, but we've definitely come a long way as far as implementing the syringe test.
Great. Thank you. That's inspiring.
Thanks.
Hi, Dakota.
Hello.
Thanks for joining us today to talk a little bit about the IDDSI.
Mm-hmm.
You're a clinical nutritionist here at Connecticut Children's Medical Center, correct?
Yep.
Can you talk a little bit about the process of testing foods for the implementation of the IDDSI and generating new menus?
Sure. It was a really interesting process, especially in my opinion, just because when we ever used to do purees before, we didn't really have, I guess, these set guidelines that we did currently. So when we first made some of the purees that we've always kind of had as our procedure right now and found that they didn't meet standards, some of them were either too thick or had, I guess, what wasn't considered smooth enough, and then others were, I guess, a little too liquidy. So having some of these guidelines, it was actually, one, really great, but then it also kind of opened up these other little check boxes that we've had to proceed with and follow and make sure that we tick as we're doing it. So we actually really had to start from the ground up from a lot of it. We would take, for example, one of the meatballs which we make, we had to take those and we would start by adding small amounts of liquid, in this case like a sauce, and doing step-by-step checking processes to kind of really make sure that we got the consistency exactly right. And then once we got what we thought was a finalized recipe, we would have to go through and put it through a nutrient analysis to ensure that was okay. And then we'd also have to check it again. It was really great working with speech too, to kind of get their input and find out exactly why a puree necessarily didn't work, or what was wrong with it and what direction we really needed to shift. I know it was very eye-opening, especially for the kitchen staff and our department's staff, just because you normally don't really get into, I guess, the specifics on what exactly each step needs to be. And then as far as the menu development, it was a lot of progress and multiple meetings about sitting down, what would work, what items wouldn't, how big do we want to start on the menus, and how small do we want to really start this and launch it off. And then we had a lot of great help from our communication department too, in formatting the menus and all the menu changes that we've developed over the many months that we've been doing this, for about 5 months. Things are still a little bit of a work in progress, but that's always the case when we're rolling out something that's such a large scale project. But it's been a great experience. I mean, a lot of different moving parts that have come together, and so far we're on track, and I'm looking forward to seeing the changes. I think it'll be great for patient satisfaction and safety.
Great. Well, thanks so much for that input and also for all your hard work to get us where we are.
Thank you.
My name is Scott Caffrey. I'm a manager in the Food and Nutrition Department. We had met with the different teams, the dietitians, the speech and pathology department, to work on different types of diets, or the diets to kind of go along with the dysphagia. We met several times to go over different processes and how that was going to affect our space and the type of equipment that we currently have. In the process of doing these meetings and trying to accommodate the patients better, we were able to find the right tools that we needed to, we were in the process of trying to find the right tools to accommodate the diet better. We found things that created consistency, so like things that help diced items better. So there's a lot more consistency with that, and items to help with pureeing. So we found other types of blenders and things that would help with that. We have some space constraints, so we were able to order some pureed items that would definitely help with the consistency, so we're serving the same item consistently.
Hi, my name is Stella Kanaris. I'm the production manager of Connecticut Children's. We work closely with our culinary team to ensure the puree diet is in the right consistency, and also doing different test trays to follow the diet restrictions of the patients and the right consistency of the food.
Currently, where we are right now with that is we are, we're definitely moving forward. We're learning new techniques of doing things. Our staff seem to kind of grasp the concept a lot better, and our patients are definitely they're benefiting from that because we're offering them more consistency.